As we've noted, the sole survivor of the West Virginia mine explosion remains hospitalized in Pittsburgh. Randall McCloy Jr. is in a medically induced coma and remains critically ill. He's receiving treatment through a hyperbaric chamber. We wanted to learn more about how a hyperbaric chamber works. Dr. Ravi Kamble is with the Maimonides Medical Center in New York City. And we should point out that Saturday Early Show producer Claire Moncrief is the person in the chamber for this demonstration. Good morning.
Good morning.
Could you explain, in this case, Randall McCloy is using the hyperbaric chamber to treat carbon monoxide poisoning. Can you explain how this chamber works?
Sure. The chamber itself is actually circulating 100% oxygen. Normally, the air we breathe in our environment is 20% oxygen, so it's 5 times the normal amount of oxygen. And in addition, it's twice the normal atmospheric pressure, so it's twice as many molecules per breath. So it's 5 times the concentration of oxygen, twice the pressure of oxygen, so it's a total of 10 times more oxygen than we normally breathe.
And the idea here is that it can actually remove carbon monoxide that attach to molecules in McCloy's brain cells?
Absolutely. You know, hyperbaric oxygen does 2 things. In the very short term, it's used to flush out the carbon monoxide that's in the bloodstream. That's for sure the short-term effect. Longer term, you're also trying to do something, you're trying to ameliorate something called reperfusion injury, which when your body is removed from the carbon monoxide, your body is in a rush to heal itself, and you kind of have, during that healing process, it actually creates some inflammation, and that actually, ironically, can cause more damage than you started with. So hyperbaric oxygen also kind of helps quell that inflammation.
Now, McCloy's doctor said the first treatments went well, but don't expect a miraculous recovery. What's the best you can hope for with a treatment like this?
That's totally patient dependent. I mean, it's really case by case. I really couldn't say on that.
Okay. As we mentioned, Claire Moncrief, our producer, has graciously volunteered to get inside the hyperbaric chamber, and I know that she can't hear us, but you can talk to her. So could you ask her what she's feeling?
Absolutely. Hi, Claire. Tracy wants to know how you're feeling. Can't hear.
We can't really hear her. So,
yeah, we lost the audio.
You know what, doctor? Will you just describe what a patient typically feels when they're in a chamber like that?
Sure. Sure. The most common scenario is it feels like you're in an airplane cabin. So you kind of feel that popping in your ear sensation, a little tightness and fullness in the ears. Beyond that, it's really not much different than what you and I are breathing right now. It's just kind of that fullness in the ear sensation, and it's a little cooler than normal just because of the circulating oxygen.
Now, I know a number of athletes use hyperbaric chambers because they think it helps them recover from injury. In fact, Terrell Owens says he actually sleeps in one. Do you recommend that?
Absolutely. Absolutely. Well, there's no medical studies that have shown definitively that it helps. I know Terrell Owens has used it. Pop musicians use it, like Michael Jackson, for example. But those are not medically indicated. They're just kind of anecdotal stories. But there's no medical science yet that proves it one way or the other.
Okay. But there's not any harm in it. There are very few side effects for this treatment.
It's an extremely safe treatment. And for sure, if you're trying to debate whether or not to use it, you should err on using it because it might help.
All right, let's hope that it helps in Randall McCloy's case. Robbie Campbell, thank you so much. And would you please give our thanks to Claire Moncrief for being our guinea pig there today?
I absolutely will. Thanks, Tracy.
All right, take care. We're actually going to go back to this hyperbaric chamber because we put a producer in a hyperbaric chamber to kind of give us an idea of what it feels like in there. And we were having a little bit of audio trouble before, but now she can actually talk to us. Hi, Dr. Campbell. Will you ask her to describe what she's feeling? Claire in there?
Absolutely, absolutely. Claire, can you hear us now?
Yes, I can hear you now.
Speak very loudly, and they want to know how you're feeling inside.
There's a lot of pressure in here. When it first started, I was in a lot of pain with my ears, so I had to pop my ears quite frequently. And it's pretty noisy in here, so you have to shout. And but it's a lot lighter, and it's kind of cooled down a little bit. The air seems a lot lighter and cooler. It's almost as if you were on an airplane.
And is that pretty typical, doctor, what she's describing?
That's absolutely typical. It's classic.
So is there a problem if you can't equalize the pressure? You know how sometimes people have a problem popping their ears? If you can't do that, should you not do hyperbaric treatment?
What happens is when we put them in the chamber and they have that pain that they can't equalize, we send them to an ear doctor and they put tubes in their ears, just like when you're a little kid and you have that same problem. And then after that, usually they're fine.
Malika, is this good? We have 30 seconds left. Is this good for any other conditions you could think of, this chamber?
No, it's really pretty much reserved for people with carbon monoxide poisoning. Very common treatment for that.
Okay.
Carbon monoxide and chronic wounds, yes.
But Claire's doing okay, you say, Doc, right?
She's doing great. She's like,
How long
great
can she
patient.
stay in there, Doc?
A usual treatment is 1 hour and 48 minutes, a little less than 2 hours.
All right, thanks so much. I guess we'll pull her out of there now. Take care. We'll be right back.